Just last year, 2 million people with serious mental illness issues were booked in jail, and nearly a quarter of the fatal shootings by police in recent years have involved people with mental illness. So now mental health advocates hope that instead of calling 911 that results in a law enforcement response, a new 988 crisis number will hopefully save lives while getting the right kind of help for someone who so desperately needs it. 988 is not only easy to remember, but would route callers right to the 24/7 National Suicide Prevention Hotline. For more on this 988 Lifeline transition, HHS Secretary Xavier Becerra joining me now. Secretary, thank you for being with us.
Kyra, thanks for having me.
So tell me, what exactly will this lifeline offer, and at what point should someone call?
First, it should offer not just real support, a real service at a time when you're in crisis, but hopefully it'll offer you hope. Just as we've gotten to know 911 as the place to go if there's an emergency and you need rescue, we would like 988 for those who are going through mental trauma, maybe drug addiction, to know that 988 is the place to go if you're suffering a crisis and you want rescue.
As you well know, phone calls happen a lot, and many of those individuals end up taking their life. So how can this new number, this access, get the right kind of help to those struggling with mental illness in time to prevent anything disastrous?
Perhaps the most important thing here is the fact that we are now going to have a service where you actually can get through. Too many of the calls that are going into the existing Lifeline phone numbers aren't getting answered, they're being dropped, and we are increasing dramatically the rate of response. That's very important. But more important than that is you don't have to worry about trying to remember a 10-digit number anymore. Now, just like 911 for emergency, 988 is all you have to remember if you're really going to reach out before you take the wrong fork in the road and go in the wrong direction. And so we already know that it's going to work because we've already seen an increase in the month of July in the number of people who are calling. But we have to make sure it's every governor in every state is fully invested, that they own this, because these are state-run crisis call centers. We're helping out quite a bit because President Biden is committed to it, but we need governors, the states, the tribal governments, the territories to commit to making this work long-term.
So if someone calls and they get someone on the line and that person is able to bring them down, to help them in that moment, what's next? I mean, is it hanging up the call, hoping that they're okay, or is there a next step where that person will actually get some type of care, will somehow be admitted somewhere if need be?
Yeah, here in Philadelphia, Pennsylvania, I was just at a crisis center where we were making the announcement of 988, and as I was getting ready to meet some of the crisis counselors, they got called out. They have a mobile crisis program where what they do is they send people out to those who called in. And so the hope here is that when you call, people only need to talk to get them through till their next visit, for example. But some people absolutely need immediate attention, and that's where these mobile crisis teams go out and they offer that service. You've got professionals answering calls, and then you have professionals who will try to respond. But I return to what I said before. If a state doesn't make real investments in 988, it'll be tough to go beyond just answering a phone. And we certainly want to go beyond that. We're now doing text and chat. And right now, the federal government, we are at HHS mostly supporting the text and chat function. So we're hoping that soon the states will be able to have that migrate into their operations as well.
Yeah, it's clearly well needed across the country. Before you go, Mr. Secretary, I have to ask you about this story that's been making headlines. That 10-year-old girl in Ohio forced to go out of state and seek an abortion after being raped. You know, critics have been attacking the Biden administration, saying that you're just not doing enough to protect the federal right to an abortion. So as HHS Secretary, are you doing everything in your power to protect that right?
First, you just got to say, when you're talking about a 10-year-old, it brings home how real this is when it comes to the issue of abortion. So whether you're 10 or whether you're older, it should make a difference. You should have access to the health care that you need, that you and your doctor have discussed. Politicians really should stay out of what is truly a health care medical decision made in private by that person. No one knows how hard it is to make a decision about abortion more than the woman who's thinking what she has to do next. And so that's the most important thing we can say, that right should be with that woman. She should have never lost it. But in terms of what we're doing, we made it very clear, the president made it clear, and I did as well, that we will do everything we can. Obviously, we're constrained because 5 justices on the Supreme Court just stripped a constitutional right from women that was there for 50 years. But we're going to do everything we can. We've already begun, and we will do more. And if anyone has any ideas of what we can do, if we haven't already started, we'll listen.
Secretary Xavier Becerra, appreciate your time today.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.